Thyroid surgery is commonly performed in the United States. However, it should not be undertaken without a thorough understanding of risk and the possible impact on a patient's quality of life. I'm Dr. Sameep Kadakia, Director of the Comprehensive Head and Neck Oncology and Reconstructive Surgery Program here at Premier Health in Dayton, Ohio. Thyroid surgery is usually performed to treat thyroid cancers. However, many times it may be recommended if your thyroid is over or underactive as well. With advances in technology, we are now able to diagnose these conditions much sooner. I will collaborate with your endocrinologist, a medical thyroid specialist, to determine the most individualized best treatment plan for you and your family. Now, thyroid surgery may involve several options. In some scenarios, we may recommend removing half of the thyroid, which we call a hemithyroidectomy. In other situations, we may recommend removing the entire thyroid, called a total thyroidectomy. Both procedures, while related, have a slightly different risk profile that's very important to understand as a patient. As with any other surgical procedure, thyroid surgery also comes with the risk of bleeding and infection. However, generally, those issues are dealt with at the time of surgery. The two specific risks that accompany thyroid surgery are number 1, changes in the voice, and number 2, possible changes in your calcium levels. The nerve that controls the voice box lies immediately behind the thyroid. Due to advances in technology, risks to this nerve are extremely rare in the United States nowadays, less than 1% in most situations. We routinely use special technology that alerts us to when this nerve is nearby. By knowing so, and by relying on our experience, we are able to find the nerve, move it aside, and safely remove the thyroid on top of that. Now, usually, if only half of the thyroid is to be removed, any risks of calcium changes is quite rare. If the entire thyroid is removed, there may be a risk to the calcium levels in your body because the glands that control calcium also live very close to the thyroid gland. Changes in voice may be a risk that accompanies whether the entire thyroid is removed or half of the thyroid, whereas changes in the calcium levels we generally find more with patients that have the entire thyroid removed. Regardless of whether half of the thyroid is removed or the entire thyroid, your safety is most important. With the advances in technology, we locate the nerve as well as these glands to then safely remove the thyroid afterwards. Nowadays, we are oftentimes able to perform the surgery as an outpatient. However, in certain cases, we may opt to keep you in the hospital overnight to check blood work. After surgery is completed, if we keep you in the hospital, we generally will check your calcium levels to make sure that it is safe for you to return home the following day. After returning home, my team will see you in the office in 1 week to ensure that you are healing well from surgery, and then we will see you again shortly after to ensure that the recovery continues to be smooth. After you have safely recovered from your thyroid surgery, we will transition your care back to your endocrinologist. Thank you for entrusting us with your care.